And so now let's talk about skin. So we've done almost a full head to toe assessment on this patient, and you can really see that as we go along, if we were the only person doing this assessment, then we'd be looking at skin all along. But we definitely want to address it with the patient. So we look at her face. Does she have any chlasma? And so that's a term that you will see again. And that is where they have that kind of darkening, maybe cheekbone, on the nose, on the forehead, sometimes on the neck. And it's just a darkening of the skin, and it definitely is differentiated from the normal skin, and it goes away. It's just from the pregnancy hormones. Another skin issue, of course, that most women have, if you don't have it, you're so lucky, and that's striae. And that would be the normal stretch marks. As the abdomen begins to distend and the skin stretches, then they begin to get these little squiggly lines, either silver or red or a darker pigment for darker skinned women. And so that's where all the creams and potions and lotions come into play, where every mommy is trying to prevent the stretch marks. It can be on the abdomen, it can be on the flank area, the lower bottom. So it can be, even if they have gained a lot of weight, then they might even see it in their arms. So those are two of the skin issues that we might see. There are some other skin issues that we might see depending on if there is some sort of liver involvement, and it's called PUPS, P-U-P-P-S. And so we'll go in that a little bit further, but that's where the patient is itching all the time, and so we want to investigate to see if she has PUPS, and that's a reason to deliver early if she in fact does have it. And so the primary changes that we will see in the skin is normal, it's with pregnancy, and so we have to teach to that. Because of course, if a patient comes and she has darker skin on her face than everywhere else, and she's trying to wear makeup to cover it, or she has striae on her abdomen, you know, she of course is going to be dismayed by that. We want to instruct that that's normal. It's going to go away after pregnancy. It's the cause is the hormones, and so that's just a normal part of pregnancy. And then now we can talk about the fetus.